Welcome. We are Peak Pursuers. We are your hosts, Rulan and Zahra. In this series, we'll talk about how we can set our children up for success, health, and happiness. And for our first episode, we'll discuss the importance of physical activity in sports and kids' lives. Joining us is Dr. Dina Bashamakh. If you don't mind, please introduce yourself, Doctor.
Hello, hi Roland. First of all, thanks for having me today. It's my pleasure meeting you girls. I'm Dr. Dina Bashamakh. I work in Dr. Sulaiman Faqih Hospital. I'm a pediatric endocrinologist, seeing cases of obesity and lack of physical activity cases. So I hope I would be able to answer all your questions and you guys get the most benefits from this interview. Thank you.
You're most welcome.
How much daily physical activity is recommended for children of different age groups?
It's not about the amount of daily activity. It should be a part of our movement throughout the day. We have to use more stairs, less screen time, more active play. But as an exercise or advisable timing, there's the World Health Organization. They gave a specific timing. It's recommended to work out at least 60 minutes. طبعا it depends on the age group. يعني you cannot compare a toddler with an older child. But if the child is more than 6 years of age, at least 60 minutes of moderate to vigorous physical activity daily. This includes aerobic workouts, muscle and bone strengthening activities like resistance exercise, basketball, tennis. This at least for 3 days per week.
Well, does the impact of inactivity differ based on the child's age? If so, how?
Of course it does. As in different age, the kids have different developmental stage, different growth rate, and specific activity routine. And you cannot compare the activity of an infant who's like 2 years of age with a 10-year-old child. Usually the toddlers are less active, and if they became less active, they will be affected as they will have delayed milestones such as delayed walking, weak muscles, abnormality in their bones, the bone deformities, and even that can affect their cognitive function. While as older age, this will affect their health, leading to obesity. In turn, will affect the physical and psychological health for those children, for this age group. So specific activities is different between age group.
What of those with development delays or disabilities? How can physical activity needs vary for them?
For those with the disabilities, the physical activity is important and considered part of their treatment plan. The doctor have to include the physical activity as a treatment plan for those with disability or developmental delay. And that's the role of the hospital also for the physiotherapy. There is a few special activities for those with disabilities, and the physiotherapists are the one treating them. So their muscles and bone won't go into something called atrophy from the lack of use of these muscles. Lack of the physical activity will increase their illness physically and also psychologically. For those cases, different kind or type of workouts as tolerated are instructed to them and to their caregivers to practice at home or even at hospital, depending on the case. The muscle that need to be strengthened or need to be empowered, that will enhance their physical health, social skills, and overall their quality of life.
Let's say the child is suffering from a lack of physical activity. What are some signs that the parents might notice?
Usually the first sign parents notice is a late sign, which is unfortunately related to weight gain. This is where they brings their child to attention that my kid is having a problem. Some people notice the weight gain related complications such as insulin resistance. They are having signs of insulin resistance. They are having low muscle tone, weakness. Some kids having behavioral and lethargy, or even lack of energy. Their kids will appear always fatigued. They prefer sedentary lifestyle and start to have depressed mood, poor attention, and social withdrawal. They don't per se notice the lack of activity, but they are noticing the complication of lacking of activity.
Finally, can you please share any success stories of children whose health significantly improved through increased physical activity?
I don't have a specific story, but I do have a lot of children who had difficulty to maintain their weight. They used to complain about lack of sleep as an effect of difficulty breathing due to obesity that impacted their school performance and self-confidence. After that, they realized that the problem was due to their sedentary lifestyle and lack of activity. They started to do few changes. They increased their activity and improved the food quality. It was difficult initially, of course, any change is difficult, but they had the willing and they really wanted that improvement in their life. Once they saw the result in their health, and they saw the body shape is changing and they felt satisfied, that actually motivated them more. And now they are trying to include their other siblings and cousins into the healthy lifestyle routine. I have one of the kids, she joined the football team and now she's going to golf and international campaigns, which is a very good example for a lot of kids that if you have the willing, your body will change. Your body will adapt to the healthy lifestyle. Your body will adapt to exercise. It's difficult at the beginning, but later on it will become more easy.
Okay, you said, doctor, you said in the question before Roland's that a child may or may not need 60 minutes of vigorous activity a day. What if a child isn't completing these 60 minutes? However, the child is physically active throughout the day, constantly getting up and sitting back down, going to get something and coming back. Do you get what I mean?
Yeah, I do get it. That's why it shouldn't be as measurement. You cannot ask a child to work out for a 60 minutes every day. So if he's having a healthy routine and he's moving most of the day, it's good enough. Later on, they might need to strengthen their muscles, their bones accordingly, but not all of us are doing a 60 minutes workout daily, but it's a recommendation. If you are doing or fulfilling the criteria of having a healthy lifestyle, you are using the stairs, you are walking, you are playing around, this is enough. It's good enough. خلاص, you are doing a good amount of exercise. You don't need to make it like a specific 60 minutes. These 60 minutes including aerobic exercise. Usually kids are using bicycles to play with, so this is included in the 60 minutes. They don't have to be continuous 60 minutes.
Thank you so much for tuning into today's episode, and a huge thank you to Dr. Dina Bashamakh for sharing your expertise with us. We hope you found the insights helpful as we explore ways to set our kids up for success, health, and happiness. Remember, physical activity and sports play such an important role in their development, and we encourage you to find ways to get your children moving. Join us next time as we dive into more topics to help you nurture the best version of your kids. Until then, stay active, stay healthy, and keep pursuing those peaks.